Be a bit brief in the introduction of the management. As a physiotherapist in the stroke management, if we have ascertained that this is actually stroke according to the physical examination, maybe we have had some CT scans or MRI scans of the brain, and we have clearly ascertained that the person has gotten a stroke, plus our physical examination, then we need to develop a treatment plan or a management plan. I will call it a management plan because when you use the term treatment, the person thinks that we are going to give something and then they become normal again in one day or two. So we need to ascertain a management plan. That is the best word to use. Management. How do we manage certain symptoms and signs after the stroke has happened? So the management of stroke is in three stages. You can call them three big stages. The first stage is the acute stage. This is mainly where we need the medical stabilization of the person. We want them to take the medicine well, manage the blood pressure, manage the blood sugar if they have diabetes, manage the cholesterol levels in case of any high values of cholesterol and other comorbidities which could have caused the stroke. So we manage them medically and we make sure that the patient is stable medically in terms of blood pressure, oxygen saturation, and altogether the heart and the lungs are working very well. The person is conscious. Make sure that the person is alive, basically, the first few days in acute management. So mainly it is the medical management, and the physical therapy comes in terms of prevention because when a person is sleeping, when they get a stroke, they are weak. Normally, they're in the bed. So we need to encourage early mobilization, maybe to sit, maybe to stand, even to walk. In these early stages, yes, we need to come in earlier enough such that we encourage mobilization, such that the person is not redundant, because that is not so good. So in the early stages, majorly it is the medical management, but physical therapy, we do some simple things, maybe mobilizations, prevention of pressure sores, prevention of contractures, and patient education and caretaker education. We educate the caretakers or the family of the patient on handling. How do we handle the client such that we prevent the complications like dislocations, maybe contractures, maybe pressure sores. So this is very important. In the first meeting, when you meet a patient as a physiotherapist in the early stage, at least you need to engage with the family and they understand what to do and what to not to do. So what they can do and what they should not do. At least they should know that earlier enough. Okay. So the first stage is the early stage. Then the second stage is the first stage actually is called the acute stage, the beginning phase. Then the next stage is called the subacute. This is a stage from around 2 weeks of the stroke. It can extend up to 6 months. Some people say up to 8 months or up to a year. In this period, this is when we have the most changes. This is where we can get the most changes in the stroke person. Maybe the person could not even sit. This is the stage where I want them to sit, to stand, to walk, depending on type of stroke. Maybe are they going to work with support or independent? This is the stage where physiotherapy is the most important of all treatment interventions, of all management interventions. So this is what we call the subacute stage. It lasts around 6 months, 8 months to a year, to around a year. Then after that, we head into the chronic stage. The chronic stage, this is where we expect, of course, the changes are going to be there, but they are going to come a bit slower. This is the word I can use. The changes will come definitely, but they will come a bit slower compared to the subacute. The subacute, the changes will come faster and the person will feel more recovery faster. Then the chronic recovery continues but at a slower pace. So these are the three stages of management of stroke in physiotherapy or generally stroke management. And physiotherapy is very important in both acute and subacute, as well as chronic, depending on the type of stroke and what is the presentation of the client, or the presentation of the patient, or the presentation of the person with the stroke. So these are the three stages of stroke management. And I'm glad to have experienced all of them in a few cases, and a few people have managed from acute all the way to the chronic stage, follow up, and other treatment interventions. So stay with me. I'll make a short video about what we do specifically in the acute stage or in the beginning stage, then what we do in the subacute stage, and then what most probably we do in the chronic stages of stroke rehabilitation. But a word for thought: stroke rehabilitation recovery never stops. This is what you should know. At least recovery never stops. From the day you get the stroke to up to 10 years, 20 years, still changes can come because the brain is evolving all the time. The brain is making new connections to try and figure out how to go about the daily activities and how to go about the different challenges the body is facing. So there are 2 points to make. When I'm closing this, at least we should have 2 points to know. First of all, stroke management, as I've said, is in three stages. The acute, the first 2 weeks; subacute, from 2 weeks to around 6 months to about a year; and then the chronic. So what do we get from here is that when the person gets a stroke and it is ascertained that the person has actually gotten a stroke, then we expect the long-term management if we have ascertained that this is actually a stroke. So it is very important as medical professionals to try and engage the caretakers, engage the family, engage the patient, and inform them about the condition and about how it is going to be a life-altering condition. They should know this such that they don't have unrealistic expectations. Stroke is not like when you get malaria or typhoid, you just get a few injections or get a few drugs and then you're okay. This one is life altering. It means it changes really the life you have been living, depending on the degree, the age, depending on several factors or the several determinants. So it should be noted that one, stroke takes a little bit of time in terms of management. This is why it is in 3 stages. This is why they grouped in 3 stages, because the time of management varies. So it is from acute, subacute, and chronic. So number 1 point to note is that stroke actually takes some time in management. This is not something which is going to go in 2 days or 3 or 1 week or 2 or a month. It could extend to a lifelong. So as long as the person stays alive, unfortunately. Okay, but this is what God has brought in. Okay, so that is point number one. Then point number two is that anytime a person is still alive, we expect changes to come because the brain is ever making connections. So we shouldn't lose morale that now I've gotten a stroke, now I'm done for it. No, please. Always there are new connections being made by the brain. So always we expect a change, be it in the first 2 weeks, be it in the first month, be it in the 3 months, be it in 12 months, be it in 2 years or 5 years, still changes can come because the brain is still evolving, is making new connections which are trying to figure out how to coordinate and how to balance and how to connect and feedback and then control the different parts of the body depending on the client presentations and characteristics. Let me hope this was a very informing one. My name is Jaka Sadiq, your favorite, most compassionate and experienced according to my view. Thank you very much for being part of this. See you again in the next video.